independent, are interdependent. You're not independent. Health and water are interdependent. Amazing how one little syllable can change a word. And will continue to impact economic growth in our country and around the world for centuries to come. More than a century has passed since our waterways went from spreaders of disease to life-giving and economy-driving resources. So the time is now to ensure that our modern water systems continue to provide unrivaled, unquestioned, life-sustaining sources. This year, we're very fortunate to have one leading moderator for all 4 sessions. We're fortunate because this will allow the discussion to become more cohesive, build off of each other, and I won't have to introduce much different people, so that's a good thing. One of the most forceful and challenging and inspiring public voices on water issues, speaking everywhere from MIT to UCLA to Hershey Chocolate and the U.S. State Department, a reporter for the Washington Post, Orlando Sentinel, the News and Observer in Raleigh, California, and since 1966, he's been a contributor to Fast Company magazine. He's won numerous awards throughout his career, most notably 3-time recipient of UCLA's Gerald Loeb Award, the most prestigious award in business journalism. Many of you might have read his book. He's the author of The Big Thirst, and he is the White House's go-to reporter for water. So our moderator for this summit that I'd like to introduce now is Mr. Charles Fishman, who will be coming up, and he will introduce the panelists for this first discussion. Let's give him a big round of applause, Charles. Good morning.
Good morning.
I'm delighted to be in Milwaukee and delighted to be able to say that I'm back in Milwaukee. I was trying to figure out how many times I've been here. This is certainly my 4th or 5th visit. I have been at Marquette. I have been at the School of Freshwater Sciences. I've been to the Global Water Center. I think I was at the Global Water Center when it opened, all different trips. And I think I came first for a great Milwaukee institution that used to be known as Schwartz Books and is now called 800 CEO Read, a great advocate of authors and reading and books. So this is, however, the first time I've ever been in Milwaukee in the spring or summer. And I must say that the city has a slightly different charm at this time of year than it does in January and February. I want to report a tiny bit of good news from Orlando this morning. I lived in Orlando for 14 years. There are still 29 people in the hospital in Orlando, and ORMC, the big regional medical center, reports that all 29 are in good and improving condition. So that is really great. I don't think either the Water Council or I quite knew what we were getting into when we joined forces 6 months ago, but I'm so delighted that they picked the word resilience to connect all of the elements of this year's conference. When I started reporting and writing about water 6 or 7 years ago, I actually almost never heard the word resilience or resilient. And in fact, if you go back 50 and 100 years, the brilliance of our water systems in the United States, which has been such a benefit economically, in terms of health, in terms of just the way we think about our world, resilience was not part of the original plan. But if there's one word that is going to take care of us going forward in terms of our relationship to water and the environment, in terms of our relationship to the water that comes out of our taps and then falls into the drain, in terms of what we do with that water when we're done with it, and in terms of the way industry and farmers use water, resilience is the single word that we should be testing all of our future water ideas and innovations and plans against. So I am very pleased that that's going to be the touchstone all day long. We're going to stop each panel about halfway through and take questions from the audience, and then take questions again at the end. So we want this to be within reason an interactive experience. We want you to be able to tap the knowledge. We're going to have 10 people up on stage over the course of 2 days. If you guys wanted to spend half an hour or 45 minutes talking to each of those 10 people, it might actually take you the rest of the year to get on their calendars. They're all going to be right up here. And so we want you to get as much out of these conversations as possible. And that includes you all asking questions. The first panel is resilient health, water and health. Just 100 years ago, as we've heard a little taste of this morning, water was actually, even in the United States, often a source not of health but of disease. Between 1900 and 1940, life expectancy in the United States went from 47 years to 63 years. A child born in 1900 couldn't even expect to live to the mid-century point. They would live to 1947. A child born in 1940, on the other hand, lived to see DNA decoded and lived well into the next century. Clean water was a huge driver of that increase in life expectancy. In fact, clean water in cities cut child mortality in half. Half the children who used to die in the United States at the turn of the last century no longer died simply because we filtered the water and added a little bit of chlorine to it. If you want to be reminded what the power of clean water is, all you have to do is look at India, a smart, rich, energetic country where 70% of the people in a hospital are in the hospital because of a waterborne disease. Okay, so we're going to talk for the next hour and 15 minutes about water and health. I guess I'm going to introduce each of the panelists. They're going to walk up here and take a seat. Ladies and gentlemen, my seat is the far seat, so line yourselves up after that. We've had a late substitution. Roger Irwin was summoned to Washington, D.C. Dr. Barry Liner has agreed to substitute. Dr. Liner, come on up. He showed up at the conference and then we put him on the panel. So if you're in the audience this morning, just think you could be in one of these chairs. Dr. Liner is director of the Water Science and Engineering Center at the Water Environment Foundation. He has a PhD in sustainable water management. So if you want to know the answers to your sustainable water management questions, he's got them. He's worked for Black & Veatch. He had an amazing job at the World Bank. I bet everybody in the room is familiar with the Millennium Development Goals. He told me this morning. He went to work for the World Bank and they asked him to come up with a reasonable definition for the phrase access to clean, safe water. And being a scientist and an engineer, the first thing he did was say, okay, what are the current definitions of that phrase? He found 600. He narrowed it down so the Millennium Development Goals could move forward. Dr. Liner started straight out of Virginia Tech in the water business. He told me this morning he bought a $480 pickup truck, drove to Florida, and went to work selling turbidometers, meters that measure the turbidity of water. And that was his entrance. He's been in the world of water ever since. Our second panelist this morning is Joel Beauvais, who is Deputy Assistant Administrator at the EPA in charge of the EPA's Office of Water. He's one of several people we're going to meet during the next 2 days who slightly apologize for being a lawyer and not an engineer. He is a lawyer. He went to Yale. He went to NYU Law School. He is one of those a member of a very small, rarefied club of former Supreme Court clerks. He clerked for Sandra Day O'Connor. So if you're looking for conversational gambits, ask him what working for Supreme Court Justice Sandra Day O'Connor was like. Straight out of college, Joel Beauvais went to the Basuas Reserve in Nicaragua to help with development efforts there, and he lived several days dugout canoe ride from the nearest reliable source of water or electricity. So we're happy to have Joel Beauvais here. Finally, we've got Magda Peck. Many of you may know her if you're Milwaukeeans. She was the founding dean of the Zilber School of Public Health at the University of Wisconsin-Milwaukee. She's now the head of her own company, MP3 Health Group. She started life as a physician's assistant. one of the first people in the United States trained to be a physician's assistant. She went on to get a degree in public health. She applied to only one school of public health. Mind you, she's gone on to be the dean of a school of public health. She applied to one school of public health. It was Harvard, and they rejected her. Her degree in public health is, however, from Harvard. Again, I will let you talk to her during one of the breaks and hear how it happens that she has a degree in public health from a school that rejected her. Magda Peck came here. It worked out differently than Trump University, that I can tell you. She came here after living for 20 years in Omaha. And here's what she said to me about living in Omaha. She said, something about Omaha having once been in the middle of the ocean really opened my eyes. And we are going to start this morning with Magda Peck talking to us briefly about A Tale of Two Cities, the devastating cryptosporidium outbreak in Milwaukee that was carried throughout the city by the water system, and how that compares to the problems we've seen in Flint that have come to light in the last 6 months. Okay, here we go.
Well, thank you. Well, good morning. No, I'm a newbie to Milwaukee, been here about 4 years. And so telling stories about a town that has adopted you and that you've adopted is always a bit dangerous. But I want to start the story briefly about the crypto outbreak in '93 by asking, how many of you were here in Milwaukee when that happened? So this is your story as well. But the antecedents of this story actually go back to 1854 in Britain with an outbreak of cholera, when a physician by the name of John Snow noticed that there was one thing in common with this particular outbreak. Now the father of epidemiology, he said, it's the handle of the pump. You take the handle away and the deaths to typhus dropped. And the antecedent for the story in crypto as well is in Paterson, New Jersey. Who knew? With the Jersey water system in 1908, when Dr. John Leal, who was the health officer and sanitary advisor, that's when you could be both, was able to think, based upon what happened in Europe after the infectious disease outbreaks, what would happen if a pinch, technical term, pinch of chlorine was put in the water supply? And the Jersey City Water District became the first fully chlorinated water system in the nation, and the deaths for typhoid fever dropped. So fast forward to 1993, in this city, not far from here, when it was noticed that there was a major absenteeism at work and in schools, and Imodium was flying off the shelves in the pharmacies, when in fact, persistent, painful, watery diarrhea had become endemic in the city. And in a period from about April 5th to April 7th, the health department, local and state, worked together and found out it's the water. And there was this moment when the mayor, Norquist, I'm told, was given a glass of water here in the mayor's office and said, would anybody like to drink this? And to a one, all of his reports said, I will not drink the water. The boil alert went out that night. And there was an immediate response that was able to detect, with the help of the CDC and others, that it was cryptosporidium, that it was not just filtration, but there was a problem in the south side plant on Howard Street. Many things happened as a result of that outbreak. One of the things that we've got to ask ourselves is, when things go wrong, when in fact the filtration system fails, okay, what do we do at that moment? Because technology inevitably will fail at some point. Immediate changes in the design happened, and design plus the monitoring and the capacity to be able to invest in infrastructure. Initially, $89 million set aside, and later $417 million to create an entire new set of standards and systems for filtration. It's interesting, it was at that point, years later, that another leader for the Milwaukee Water Works said, the outbreak made us realize that we're in the public health protection business. When was it that water systems and the public health systems became so divorced from one another? The crypto outbreak here reminded us of the interdependence of your health system and your water systems overall, and in reconnecting that, a major lesson learned to prevent further waterborne outbreaks in the future. But what we also learned, I'm told, here in Milwaukee, and I see evidence now as a public health leader in the city, is that it was seized as a moment to think bigger, to go beyond the eventually 91 chemicals that you're supposed to monitor with the EPA. I believe that's correct. But there's more than 500 chemicals that we monitor in this system, in this city, voluntarily, with the technology that you've heard about already mentioned today. We've already been proactive about how are we disposing of our medications, thinking ahead about the particles in water. We've recognized that when docs didn't test for cryptosporidium, they assumed it wasn't there. So the healthcare system was brought in to know what is the standardized testing that needs to happen when diarrhea presents. We learned to recognize and ask who is the most vulnerable. And at that point, although 400,000 people plus were affected, and perhaps over 100 died, although it's officially reported to 69 deaths in the New England Journal of Medicine. Bottom line is, what we learned is that the vulnerable will be most susceptible. And in this city, it was people with HIV and AIDS. And about over 95% of those deaths were folks who were immunocompromised. And finally, we learned that it's not just about loss of life. We learned that it's not just about loss of productivity and days in school. What was violated in this town was a loss of confidence in public systems. It was loss of confidence in that the water you turned on your tap could be safe. Fast forward to Flint. What I can tell you is it's not a waterborne disease. It is a failure of deteriorating infrastructure with the relentless corrosive water diverted now from the Flint River. But there are failures there as well that we will talk about, that we can borrow from Milwaukee and apply to Flint about how you respond when systems fail. Failure of oversight, failure of technology, failure to listen to a different set of alarms, the alarms of the citizens themselves who said immediately when the water was diverted, this smells funny, this doesn't look right, do something. And it took 2 years for those alarms to be heard. We have a tale of two cities to look ahead, from infectious disease to, in fact, more neurotoxins with the neuroscience we have. This is the beginning of the next 100 years of monitoring, where we reawaken the kinship and the interdependence of health and water. And our city can inform Flint and others in the next generation of great water impact. A powerful story, one that I hope we'll go into. But if we don't pay attention, we've got a whole generation of children whose brains are compromised because of the failures, not just of technology, of the people who were to safeguard them.
Great. So you used an interesting word. You said back in 1993, one of the great costs of the cryptosporidium outbreak was confidence in the system. And of course, that's a wonderful connection, a sad connection to Flint, which is that the lead contamination in Flint not only created a huge lack of confidence in Flint's system, understandably, but made people suspicious of their own tap water wherever they lived in the United States. And of course, one of the hallmarks of the water community, of the water world in the United States, is in fact confidence in the water system. So Joel Beauvais, let me put you on the spot and ask this question. Is Flint an exception to the quality of our tap water and the diligence of our tap water system, or is it a warning about the condition of water systems sprinkled around and the technology we've been relying on, or is it a little bit of both?
Yeah, I was going to take the easy way out and say it's both.
Okay.
Definitely, I think there's a lot that's unique about what happened in Flint and the particular challenges that system faced and decisions that were made along the way. But I think what's important for us going forward is really to recognize that it's indicative of challenges that many systems around the country are facing. And that's something we really need to zero in on. And there's a number of aspects that are there. One of which is just the infrastructure challenge. A city like Flint where the system was built for 250,000, you had 200,000 people living there during, as late as the 70s. It's now a city of 96,000, has a system that really is way overbuilt for the community that's there now, a system that's been underinvested in. That kind of post-industrial decline, Flint's not the only city that's facing that challenge in the United States. And it also reminds us that there are a number of smaller systems, particularly around the country, that are also facing some significant challenges. So I think, Flint is the gateway to a lot of conversations. It's a gateway to a conversation about aging infrastructure. It's a gateway to a conversation about the importance of effective utility management, about the importance of effective state and federal oversight. And it's a gateway to a conversation around environmental justice and equity, and making sure that we're being particularly attentive to those systems and communities where the sort of the economic and the organizational infrastructure isn't as strong as we need it to be to effectively manage those systems. So that's really helped, I think, to elevate a conversation across the United States. And lead is one challenge that we face in many systems around the country. And we've really stepped up our efforts considerably in that area, but there are other challenges as well, of course.
So let me follow up with you with just one question. I think we don't often, especially in the United States, we don't often connect water, public health, and infrastructure. What's the connection between the declining state of our infrastructure? I'm sure everybody in the room knows the American Society of Civil Engineers rates the water infrastructure at D- in the United States, despite the fact that when you turn the water on, it works almost everywhere. What's the connection between the fact that those pipes and treatment plants need to be replaced and upgraded and public health? Why is there a connection?
Well, I think there's a lot of different manifestations of that. Maybe the most basic one is that amazingly in this country, we have 240,000 water main breaks every year, something like over 700 a day. Well over 1 trillion gallons of water every year are lost. That's a major, that's treated drinking water that we've paid to treat that is just, going, I guess, not down the drain, but out into the...
It's not even going down the drain.
Right, exactly. Not even going down the drain. But obviously, that's, every one of those breaks is the trigger for the boil water, order, because it represents an opportunity for pathogens, or contaminants to get into the system. That's the most kind of, basic level at which that's true. But there's a lot of other manifestations. So, somewhere between 6 and 10 million lead service lines, serving customers across the country. The relic of, an earlier era when the public health, risks associated with lead plumbing were not recognized, and the challenge of working towards a world in which that risk isn't there anymore, is another manifestation of this. Some of the challenges that smaller systems and rural systems are facing around the country, so you have places like San Joaquin Valley in California, where you've got literally close to 1 million people who are living with water systems either where they just don't have access or where systems don't even meet standards for, say, arsenic or nitrates. So we've got a lot of challenges, I think, that are relatively hidden to the average member of the public that we really need to focus in on and kind of elevate our game in meeting those challenges.
Okay. Dr. Liner, you've worked outside the U.S. Tell us the story of how you ended up going to Peru and the Andes and the Amazon, and whether what you saw there has any relevance to this conversation about awakening us to connecting water and public health in a country where we haven't had to worry about that connection.
Sure. So when I first started at the World Bank safe, sustainable access to water. And I was like, okay, great. We have to have chlorine residual, right? I said, no, we want to make sure the well is covered so that animals don't get in there. Animal waste doesn't get in there. And I said, okay, safe, sustainable access to sanitation. Oh, we have no CSOs, anything like that. No, we want to make sure they have a good latrine. And so it was an eye-opener to me about that. So I actually went down and I formed an organization when I was a professor at George Mason, working with Engineers Without Borders and some other groups to go down to Peru. And like Joel's story, I was in an area in the Amazon that was 4 hours by fast boat from the nearest toilet, electricity, or water. And this tribe, this indigenous tribe, was drinking directly out of the Amazon. And it was kind of a morbid joke in that it was the best place in the world to be a kid if you could make it till 6. Because you could climb up and eat fruit and you can swim in the water anytime you wanted. It was a blast. But they had, of course, drinking directly out of the Amazon and not having latrines or anything else like that. They had a serious, not only infant mortality, but youth mortality rate. And one of the things that we were able to do down there is find out what assets they actually had. And there's a lot of sand in the Amazon. There's no rocks, there's nothing else in this group. They had access to a lot of sand. So we helped them make slow sand filters. And we also helped them with hand washing and other kind of hygiene, which is actually a very valuable effort. Over the time, as we were teaching them how to make these slow sand filters out of buckets, out of 30-gallon or 55-gallon drums, the important thing was they built them, we didn't build them. That there was a local community that was involved, making the decisions using locally available resources and put these in place. Over time, over the 3 years, 4 years since that project has been in place, the mortality rate has dropped dramatically. The hydration rate of these people, because they used to not drink because they were afraid of getting sick, would now drink water, and that helps their overall health as well. So just doing that was very, it was amazing to take the students down there and do that. It was great to see these small communities really improve their public health on that. So how does a village of 100 people in the Amazon relate to up here in the U.S. Or any developed country? Well, involving the people and listening to the community, as Joel was talking about, these are the people there were saying, we have a problem, and a former group came in and tried to do something, and they built it and left, and it was worthless. The people who actually were the customers and the community have to be involved in that solution and using locally available resources. And the other thing is we were building them solutions that would last 30 years for them and the O&M that they could afford. Whether it's getting sand out of a sandbar in the middle of the Amazon or providing solutions that you can afford with the infrastructure that we face today, the problems are just of scale. But it's basically the same problems.
Magda, when you and I talked, you said something that I found intriguing, and I'd like you to try and sort of unpack it a little bit for the group this morning. You said we can use the lessons of public health to help water, and we can use the lessons from water to help public health. How do we do that? What does it mean to do that?
So I think that the first is that there's been a disconnect between the water systems and the health systems. And so the first, in terms of being interdependent and one helping the other, is to recognize each other. And particularly from a governmental perspective, they've grown up in silos next to each other. Okay. And so part of it is being able to reconfigure the system that allows it to be much more graded and much more independent. Now, I think that the lessons from public health tell us that, and much as Barry was saying, that public health is defined by 4 basic things that make it public health. The first is that it's about prevention. It's upstream. We're to think about things before they happen, and when they happen, they're not so bad, and they shouldn't happen again. So public health defined as the science of prevention. And so taking that first element, what public health can offer into the water side, is to not think about just now, but take that primary, secondary, tertiary approach in the design of water systems to say, how can it up front prevent both the water pathogens as well as the toxins that may come, say, from lead to happen in the first place. The second is, how do we filter and make sure that if it is present, it isn't there in the greatest degree. And third is that when things break and go wrong, you seize that as the most uninvited gift to absolutely make something else possible that could not have been possible before. So prevention is one. The second lesson I think that public health can bring to water, and then water can bring back in the form of greater health, is that it's not just about individuals, it's about people and communities. We're the zoom out folks. We're not going to look at this particular person with diarrhea going to this doctor. We're going to be looking at zooming out and saying, what are the patterns that happen? And I think that ability to zoom out and look at populations of people and communities is something that we can share with the water industry. And water does that in a different way, but we don't necessarily hear those lessons on the public health side. Third, public health is never a science by itself. It is by definition interdisciplinary and interdependent. So silos have to be broken down. And I think that if we take that approach to figuring out how the two leverage each other, great. But the fourth, and that's the piece that I want to thank Joel for bringing up, is that public health, according to a former CDC director, Bill Fahey, who was probably responsible for the eradication of smallpox in India, in part among others. But the bottom line is he would say, that the philosophy of public health is justice, social and environmental justice. We're the ones who have to worry about everybody, not just a few. The Flint situation shows us that the vulnerable are not vulnerable because of their own personal behaviors, that their zip code is more likely to determine whether they're affected in Flint than their genetic code. And so I think that there are lessons from public health to be able to bring and ask the questions of equity and justice, and to work with industry to say that we can have lots of bottom lines. We can do well and do good. And I think that by working together, it's going to be a better outcome.
I love all those. I'm glad you started with prevention, because of course what we know about Flint is that situation could have been prevented. And right now, communities around the country, 80% of the dollars spent battling climate change are spent after the disaster, and 20% are spent getting ready for the disaster. And if you flipped those numbers, everybody would be a lot better off, and you'd end up spending 100% would actually be smaller. What I like to say is there's never been a wet spot on the ceiling in your house that took care of itself. You don't ignore a leak in the roof and hope that it stops leaking. And every single water problem I have ever encountered is exactly the same. They don't ever get better by themselves. So the moment you know it's a problem, that's really the moment to tackle it. Joel Beauvais, you alluded to small systems. And again, I think it's your perspective immersed in grappling with these problems every day. Why are small systems, of course, have to, at least in theory, meet the same standards as New York City and Seattle and Los Angeles. Why are small systems at a disadvantage when it comes to maintaining the health of the water supply? And I don't know if people in the room know, there are 55,000 water systems in the United States. 1,000 of them account for half the people in the country. 30,000 of them account for about 10% of the people in the country. So there are literally hundreds, 10 water systems per county in the US, each serving, 4,000 people. But the quality of the water that those 4,000 people get is supposed to be the same as the quality of the water in Boston. Why is that a problem? And what are you guys trying to do about it?
Well, it's a challenge.
Joel has visited all 55.
Right, exactly. It's just part of
Thanks,
my
Joel.
duties.
We
Yeah,
appreciate
yeah,
it.
exactly. Boy, am I tired. But I mean, there's so many dimensions of this challenge. I mean, if you look at it from the water systems perspective, you know, there's just what's very basic and intuitive is the challenge of scale. You know, you have certain fixed costs that need to be met in terms of infrastructure to meet a certain level of water quality, 90 national primary drinking water regulations that we have. If you're spreading those costs across 100 people or fewer than 500 people, which is like 24% of our public water systems, that's a real challenge to support that from a rate base perspective, and just to have that scale from a management capacity perspective, to have a certified drinking water system operator who really knows what they're doing, has a strong sense of asset management, knows what's in the system, and is able to look proactively at how we get things replaced on a schedule. So
a lot of these water systems are literally like corner convenience stores.
Right.
Run by a guy or
right.
or a married couple.
Is the drinking water system operator. So there's some significant challenges there. Another kind of hidden challenge associated with the multiplicity of small systems that we have in this country. And remember, so 55,000 or 52,000 maybe community water systems. That's compared to, say, 1,300 electric utilities, just to give you and even in an electric utility world, the vast majority of those are small. So it just gives you a little bit of sense of the two orders of magnitude difference there. But a hidden aspect of this is actually the challenge that this poses for the regulators that oversee these systems. You talk to any state drinking water regulator, and they will tell you that they spend the vast majority of their time addressing issues associated with smaller systems, just because of these capacity challenges that they have, and the underlying economics and sort of organizational and institutional capacity challenges that they have. So that's kind of something that I think most folks don't think about, but presents a real challenge if you look then at where we spend our resources. So we oversee the state revolving funds, and on the drinking water side, I think probably while the state revolving funds probably dedicate around 25 to 30% of the actual money to small systems, they account for something like 70% of the applications and agreements. So there's even just that kind of transactional basis. So then what? So there's an ongoing conversation around the country around, in some cases there's geographic isolation and or other reasons why pipe-to-pipe connections don't make sense, but there's a real conversation around partnerships and regionalization. Where are there opportunities to share at least services, administrative services, management services, if not pipe-to-pipe connections? And some states are making relatively bold moves forward in this area. Others have not been as proactive.
What's a bold move? What does that look like?
Well, I'll give you two examples. So one is the state of Kentucky, where they've gone from, and I probably will get these numbers not quite right, but basically over the course of the last 10 to 15 years, they've gone from having around 1,800 different water systems in the state to having more in the range of 360 or something like that, through a concerted state policy of incentivizing system consolidation, precisely to address these types of challenges, and using financial incentives and policy incentives to sort of help that process along. California is, and this has been in the news a little bit recently with the system of Tulare, has recently adopted a law that allows essentially for, and I don't want to mischaracterize the law for any California water experts out there, but essentially offers an opportunity for mandatory consolidation where systems are not able consistently to meet health-based standards, that they really need to be brought together with a sister system that's larger and that capacity, which presents challenges both for the small system and for the larger system that becomes.
It takes them on. Right?
Exactly. So that's not at all the only model, and there's a lot of work that's going on in the less sort of concerted government-driven or mandatory consolidation model around fostering partnerships. I think people who work in this space, I've heard folks characterize it as it's a lot like a very slow version of dating. It can take years for systems to want to come together in these kind of arrangements, because of these basic trust and autonomy issues. But I think from an objective perspective, if you look at the challenges that the country is facing, you'd have to say that we do need to get to a different place than where we are now over time.
And the partnerships are sort of a basic, that's sort of an easy, maybe not easy, but much easier than legislation and so forth.
Well, I think it allows this to happen from a bottom-up perspective, because I think there's a lot of, it's been interesting to me as someone who's relatively recent to the water world to hear the intensity of feelings that local jurisdictions can have around their control of their local water system. The ability of the mayor to fire the gal or the guy who runs the system, as opposed to having it be in somebody else's
hands. Right.
Hands.
Free jurisdiction.
There's a lot of local autonomy issues around that. So it's, I think, top-down efforts at this are likely to meet with significant resistance in many areas of the country. So
partnerships are acceptable, but also help these systems tap the expertise they need to do even just the basics.
That's the
idea.
Yeah.
Okay, let's pause a minute. Are there some questions from the audience? I think we actually have microphones. Are there microphones? This guy in the yellow tie right here is right here.
Yeah.
Wait, I think they want you to bring the microphone up. He's right here. Just because they want you on tape for the archival YouTube viewers who will be tapping the summit in decades to come. Go ahead, sir.
I have a question for Joel. There is technology that could be used at the local level, but resources are a barrier. Is there a possibility that EVA would be more involved in getting small-scale use of technologies which are currently out there?
I'd absolutely like to see us in that game, because we have to, adopt new strategies. They need to be ones that are, I think that it's another area where regionalization and partnerships can actually help to facilitate even those decentralized technologies. But as I think was implicit in your question, it's not just a matter of having the capital investment up front. It's a matter of being able to sustainably operate. Same kind of challenges that you'd be facing in the developing world on our, maybe somewhat higher level. You've got to have the ability to do that operations and maintenance and to have the organizational and the institutional.
What technology are you imagining? Okay, go ahead.
Ways that you can have a much better sense. It involves sensors and continuous monitoring. So a lot of the systems run by janitors or whomever you characterize, they have no way of knowing that something's going wrong. And we have—
because the systems are small and they don't have that.
They're just not technically, they're not self-reporting. But if you could include these sensors and alarms or actual responses to given conditions which are detected in those waters.
Okay. There's no move to put in place regulations requiring that kind of stuff. That would be really expensive and really...
Well, I'm not sure that we really have that from a distribution system perspective, even with the large systems. So I don't know that we would start with the small systems. I do think that and I actually wanted to touch on this, if you don't mind. Earlier, you were talking about public confidence and the criticality of building and restoring public confidence. But public confidence has to be, kind of earned, right? And if we're going to earn, restore, rebuild, continue, strengthen public confidence, it has to be built on information, right? And sharing of, we have to work with our public health colleagues to think about how we can appropriately share information about risk to help sensitize people to what the opportunities and challenges are, particularly in drinking water system management. And I think sensor technology and new information technology platforms for communication of information, both between utilities and regulators and up the regulatory chain and out to the general public, presents a real opportunity of the future for us, sort of within the systems. Source water protection, vulnerability assessment, another area that we really need to be increasingly focused upon. And again, technology can be an aid in that.
Can I follow up real quick? Because I'm curious, and Sam, I'm trying to figure out if your question is not only about technology, but one of the things that we're finding is these are human failures, not just technical failures, or shortcomings or lack of investment. So, Joel, can you talk a little bit about whether it's small water systems or in larger water systems, how do we get the human capacity to be able to do the monitoring, to be able to interpret the data, to be able to do the kind of corrections necessary? Are we preparing folks, janitor aside?
Right.
It's people who run systems. So what about the people investment of human capital into the systems that work small and large? I'd love to hear about that, former dean.
Yeah.
I want people to be able to sound the alarm, not just the citizens who find the water unacceptable.
Absolutely.
Let's just define the word capacity for a minute, which is a term of art. You're talking about training, responsiveness, a sense of responsibility, a sense of ownership, and a sense of what to do when you find something wrong.
Yeah, so EPA, for example, has spent the last many years working very closely with some of the key water utility organizations, including WEF, on a framework called the Effective Utility Management Framework. And it's kind of, it's what you would expect. It's the totality of all the parts. It's not just, sort of the regulatory oversight part, asset management, the financial, public communication, and really kind of working on that model. That model is really not for it's not for the Milwaukees of the world. It's to try to help, the littler guys to have a roadmap to try to be more like the Milwaukees of the world. One of the things we often talk about we're living in a world here where you have these great utility gazelles, across the country. They're thinking about water in a whole new way, right? Adopting the technologies of the future, investing intensively in public communication, looking at water as a resource, forming effective partnerships. And then we've got this whole other world of, these utilities that are struggling just to keep up, whether it be in communities like Flint or in some of these smaller communities around the country. And so I think one of the things that we're very interested in investing, we do a lot of work in capacity building for small systems, and spend some significant dollars in that area in partnership with other agencies and entities out in the world. We're also very interested in working with the utilities on thinking about a framework for peer-to-peer, work and partnerships, because there's so much knowledge and capacity that there's an opportunity for that, for that learning and sharing and capacity building to happen. And I think there's really an appetite for that in the utility community.
So, Barry, as Joel is answering that question, I'm immediately thinking the EPA already has more to do than it has staff and resources, and then Congress is willing to. There's not going to be any doubling of the EPA budget in the next 4 years. But what about the AWWA and WEF? And is this an issue you all talk about? In other words, it sounds like one way of helping grab hold of this problem is for grown-up, bigger water utilities to sort of big brother, big sister with smaller water utilities just in an advisory capacity. If you have this problem, here's what you can do. Here's the person you can call here in Milwaukee. If you get in trouble, we're happy to help. Is there any organized effort to do that? And would that be something that those two big, the AWWA on the drinking water side and WEF, you guys on the used water side, is that something that could really help? Is it something you do?
Well, I don't know of a formal mentorship program that's put in place for that. However, there are a number of informal programs regionally and even internationally, sharing information between some of these more advanced utilities and some of the smaller utilities. That happens all the time. There's many events similar to this where there's at the state level and the local level with National Rural Water Association as well, trying to provide additional training and feedback and relationships between all of the various groups. It's a huge challenge, and you mentioned defining capacity. It's not, we normally in an engineering sense we think of capacity as how many gallons do we have available or can we treat, right? It's not the people side of things. But on a different note about that, one of the things we keep talking about is the water quality, drinking water quality, and we don't drink a lot of water. Depends on what the numbers you look at. 98% to 99.5% is used outside of consumption. And in some ways we could look at things differently, and there's places that are doing it. I mean, I'm sure that A.O. Smith, to put a plug in for the local guys, would love to have their point of view systems everywhere, and then we don't have to treat necessarily to that level, the drinking water level, to wash clothes or to do some things like that. So there's other things that, as our infrastructure problem is huge, as everybody in here knows. There's other ways that we can look at things, and not a one size fits all, but we need to look at the full suite of options that includes the regionalization, the training, the new ways to the distributed technology, like the gentleman was talking about.
Okay. I wanted to ask, I want to tackle the next big untackleable topic in this arena, which is the emerging contaminants arena. One of the questions I get, just as somebody who's out in public talking about water, people have become a little suspicious about what's in their water. Is there Prozac in my water? Is there blood pressure medicine in my water? If you walk into the shower of either my wife or my daughter, there's 30 hair care products in there, 25 of which didn't even exist 30 years ago, all, of course, going into the waste stream. There seems to be a sort of growing concern. It's the tap water version of, if I leave a bottle of water in my car, during the workday, can I drink it when I get back to my car? What's going into the water, and what are we doing to take it out? And Barry, I know you're paying some attention to that. So tell us what the state of the emerging contaminants conversation is, and what the right way, what people think the right way to tackle it.
So one of the biggest problems we have with respect to emerging contaminants is the communication of science with and public communication, and because we don't necessarily, engineers,
science versus perception is what you would say.
Right, exactly. And so the industry is very interested in looking forward and seeing about these contaminants of emerging concern and pharmaceuticals. There's also some opportunities for resource recovery and harvesting these things. So sometimes you mentioned taking a problem and actually turning it into an advantage moving forward. What we've also seen is the technology, as monitoring and sensor technology gets better, we're actually getting hits now at 1 part per trillion, when before it would have been a non-detect. So now, oh my God, there's 1 part per trillion of whatever chemical it is in my water, or in the biosolids, or the organic fertilizer that we can apply. So there's a lot of trying to understand the science piece of it, and we keep advancing in research for the treatment side there. But also the water sector historically, both water, wastewater, and stormwater, have kept a low profile. Please, we don't want to be in the press. We don't want to run into guys like you, right? So, but we've got to understand that that's very important. That we need to have the communication that this is safe, and we also have to be vigilant of the risks of these things, because we don't know about some of this. So, not to be alarmist, but we have to be proactively seeking this, and that is what's going on.
Right. The communication is actually quite complicated.
Yes.
Because there's basically nothing in the water, except if you're a scientist, 1 part per trillion means there is something in the water. And so how you have that conversation in a way that people can understand. If I did my math right when I was trying to explain this, if you think about the number of pennies that float around in your life, in the cup holder, in your car, in your pocket, in the drawer by your bedside table, 1 part per trillion is 1 penny out of $10 million. There may be some people in the room who are going to earn $10 million in their lives, but you have to earn $100,000 for 100 years in a row to earn $10 million. So 1 part per trillion is 1 penny out of your entire lifetime's earnings. That's a good way of explaining it to ordinary people. It is the equivalent of nothing. Go ahead, Magda, you want to jump in? No, it's not nothing.
If that penny's in your pocket, so one of the things in public health.
No, if that penny's in your bloodstream, that's when you're in trouble.
Well, the exposure. But I think that this notion about risk, what is acceptable risk, has been changing over time. It's one of the larger issues we deal with in public health. It's not just a communications issue only, but it also is what's the threshold up which we're going to say this is acceptable risk. If you look at vaccination, right now there is we deal with, well, what is the risk of having some side effect relative to the benefit of preventing this infectious disease? In this country in particular, there's such a little tolerance for any risk. I think it's become an expectation of science that exceeds its capacity, and hence people are disappointed, which is, you cannot guarantee me 100%. So I think part of our job—
We actually tend to focus on the exception rather than the rule.
Absolutely.
I think that is a communication problem.
I think it's a communication problem, but I also think it's a numeracy problem. Meaning, in that I think
it's an ignorance problem.
I think that people don't. I think there is a basic lack of capacity to interpret the basic math of rate, ratios, and proportions. So everything becomes a sentinel event. And I think that the notion of how do you calculate risk, how do you communicate risk, and what risk is acceptable is a cultural issue that is, we better seize this moment around water to get out. That's where water can teach health in a way that I think gives us opportunity. So I'm just curious, because in EPA, you work and government works with standards, right? Well, I mean, in the crypto outbreak here, this safe followed the standards. It's just the standards were pretty minimal, and disease broke through. So in setting standards and saying what is acceptable risk, someone's going to get sick and someone's still going to die. Can't be 100%. How do we manage that? And how do our industry partners guarantee for customers what is the threshold of quality? And I just think it's a larger issue overall. So I was curious, from a governmental, putting you to speak for all government agencies. And if you could solve this one, we really appreciate it. But when you say what is acceptable risk, how do you make that decision? And then how do you communicate it in a way that recognizes that still will be some harm?
Right, absolutely. And I mean, there's so many dimensions of this, as you point out. You know, there's the four corners of setting a standard, and what is the Safe Drinking Water Act? You know, what's the analysis, the benefit cost analysis that is required of the agency to make those determinations. That can't account for everything that happens in the world and decisions that get made. And then there's unregulated contaminants, which I think is where we started this conversation. The multiplicity of which it's challenging to imagine that we could put those all through the process, the regulatory process that we've done for the 90. So you get into this interesting situation where you have a set of contaminants that are the common ones that we've regulated, where there really has been a rigorous risk analysis done. People have thought, how much money should we spend on trying to solve this and to what extent? And then you've got these other ones that haven't made it through the process. And for those, you just have health effects information if you have that. And so people, you know, that balancing conversation or analysis hasn't even happened yet. It becomes kind of this binary thing of, well, either I'm over the health-based level or I'm under it. And if I'm over it, I'm probably going to die tomorrow. And if I'm under it, I'm safe. And of course,
it doesn't work like that.
That's not really the way the world works.
Barry, you look like you want to jump in.
So you know, a fun way to try to communicate risk goes on. And Kevin Schaefer is heavily involved in this. You know, as we move towards resource recovery and have water reuse, a lot of people are scared about what's in the water reuse. So Milwaukee and Portland, Oregon, and groups like Half Moon Bay Brewing out in California are actually brewing beer out of reuse, out of effluent, to highlight that, because water should be judged by its quality, not its history. You know, good taglines like that, but try to communicate with people. Toilet to tap scares people, but you know what? I'll go drink a beer, and then you realize, yeah, well, I'm scared of what would be in the beer. Well, you know what? 10,000 years ago, that's what we did, was beer and wine for more risk management. And so using reuse beer as a way to encourage the discussion about risk management and water quality is one example that's been very successful so far.
I'll just add one other, and that is, as we have this opening to be able to have a conversation about risk, we've got to think about it not just for now and not just in my next generation of children, but transgenerational effects. This is another thing for us to look at. There are, the science will tell us that it's not just about mother to baby or about one generation, but multiple generations out where there is no direct link to exposure. We have to be thinking into the future for future generations, and most risk is still perceived of as now. So we had a chance to frame that conversation about risk, particularly in the unknown between the 90 and the 500 chemicals that are tested for here in Milwaukee. We don't know, research will tell us, but we better be asking questions about what we know. That's not just about what are the effects today.
Right. Well, and it's there's another interesting element, which is, if you use vaccines as an example, one of the reasons we don't assess risk very well is that we've forgotten what problem got solved and how devastating that problem was. That's not to minimize the consequences of people who have side effects from things like vaccines, but we've forgotten how bad it was and how far we've come. And so I mean, I think communication is hard, but the truth is the water world hasn't practiced, doesn't do it very well. And so that to me is a huge opportunity and the time to talk about what's in your water, whether it's safe, why it's safe, what it means for water to be safe is before Flint, before Milwaukee's crypto, so that there's a little bit of a well of both knowledge and to some degree goodwill. You know, people feel like, okay, I have a sense these people actually know what they're doing and they talk about how they do it, so I know a little bit about that too. Okay, let's go back to the audience for a couple questions. We have about 10 minutes, so sure, if you know where you're going, go. Yeah, why don't you tell us who you are?
My name's Rupert Whiting. I'm in town from Vancouver, BC.
Great.
Part of the brew program. And it was great last night at the Mix and Mingler, because I met 2 or 3 people who were talking about the true cost of water and how people in this room will appreciate that the vast majority of people don't pay for the true cost of water that they receive. And I think it speaks to the risk issues that we're talking about. So I just asked the panel for what's one practical thing that you think can happen in the next little while that will bring to the awareness of the paying public the true cost of water, to get them more willing to pay more for their water, so that utilities and service providers have more money as resources and the resources, because at the moment it's very difficult to provide people the services they want at the money they're prepared to pay for the water.
Barry, I'm going to go to you first, because you talked to me about thank you very much, about the connection.
Is it safe?
It is absolutely safe. It's Milwaukee water, come on. About the connection between thinking differently about wastewater and that actually underscoring the value of water.
Right, so switching from, well, there's a first thing about the value of water. There is a group called the Value of Water Coalition, which is a group of about 8 associations plus large consulting firms and manufacturers that their intent is to raise the profile of the value of water itself. So that is, they're trying to address
smart marketing.
Says right. There are, so our focus with AWWA has been moving from wastewater as a waste disposal to resource recovery, and nutrients, energy, and water that you can recover that, put the value back in it. In fact, because we mentioned these emergent contaminants of emerging concern, if we can harvest some of that back, before, and not treat it, but harvest it, and so there it raises that profile. And many of you know that all of our publications since 2013 never mentioned wastewater treatment plant. They mentioned water resource recovery facilities. We want to change that mindset. And you can see.
Let me interrupt you for 1 second. I just want to underscore the sort of wonderful irony that if you regard used water as recyclable, as a source of resources, you actually increase the value. It goes from being garbage to being something that you can get energy, fertilizer, and water out of. And so it's actually compost. Right. It's actually kind of a wonderful flip. I'm sorry. Go ahead.
And you need to communicate that as well, not just to us, but outside. And a great example is DC Water, and I think George Hawkins will be talking tomorrow. He may correct me on this, but they've doubled rates twice over the last 10 years or 15 years, something like that. But they've got a great relationship with the press. They've got a great, they share information. They've met the Chesapeake Bay TMDL more than 10 years in advance. And they're touting that. They're saying, we're doing good things. And those of you who may have lived in DC 15, 20 years ago, there was a lead problem, and DC WASA was not necessarily regarded well. And now we have George Hawkins running around and being the poster child for this is what you can do with good management and good communications. And they've done a spectacular job.
Joel, you want to jump in on this question?
So I'll take a different tack on this that's a little bit contrarian, but I sit in a lot of value of water conversations, and the smart marketing piece I think is absolutely incredibly important, better public communication, public service announcements, and so forth. And I think that's all incredibly important, and we can do a lot better on it. I think that if we don't get better at using the tools of the 21st century to sort of communicate the what's in your water and what's at stake question, I think it's going to continue. It's going to be hard to animate public investment in something that we think we already have. We take it for granted because we think we already have. It's all wrapped up. It's taken care of, and so nobody really. People, and utilities and regulators are afraid to talk about sort of risk and what's at stake because we're afraid we're going to turn people off this product. We're going to reduce public confidence in these systems. So there's definitely a sort of a challenge here of what's the strategic way to do this. But we have to be able to talk about what's at stake in these investment decisions. And I really think information and better use of information technology is what's ultimately going to, kind of crack this open.
You're literally talking about transparency, about water utilities saying,
right. There's
a tab that says data, or what's in your water or whatever, and then actually telling people how the system works, what do they look for, what's there, what does it mean?
Two dimensions of this, one is in the regulatory paradigm. What's the way that utilities communicate compliance information to their state regulators, communicate it up to EPA?
Internally.
Right, and sort of what is the transparency and visibility for compliance assessment purposes of that? And then what of that information and how, can be communicated out to the public to provide that transparency and accountability in the relationship. You think about any other consumer product on which we depend to this level, there are expectations around information and transparency that we don't have in utility world in the electrons that come to our house, or the more
as compare the nutrition information panel on a box of Oreos versus the water utility report that gets sent to my house. Yes, the communication skill that's brought to bear is very different.
Yeah, so we just, I think we just have to recognize that we need to think about this. And I think the message is not, the sky is falling, your water is unsafe. The message is we have delivered, one of the greatest water systems in the world, a system that's the envy of much of the world, and the points that you made very, testify to that. But we're gonna, if we want to continue to have that system and to resolve these, these persistent equity issues that we have with certain systems and with small systems and so forth, we've got to figure out a way to make the public more aware of what's at stake in this. Why does this matter for your public health? Why is this an important place to spend your, because ultimately when it comes back to the utility and the question is, can I raise my rates in order to pay for all this great stuff that, that we need to do? The public and elected leaders have to
have that support.
That is a value that is worth investing in, and then if we want to get to a conversation that's sort of not just I need to comply with the law, but I want to go to a more proactive risk assessment framework where I'm going to really be looking at my source water and making decisions about how can I invest in source water protection versus the investments that I might make at my plant in broader spectrum treatment technologies to address risks that might not be strictly required by the regulations. Then you're really going to need that conversation.
That's great. Where's our microphone guy? Okay, hang on, Kat, we'll get to you. Let's take this one right here.
My name is H.J. Lewis with ABB, and my question is...
Can you stand?
There you are. Sorry, sir.
Voice of God.
Go ahead.
How does private water play into the entire discussion, and how does public health work with private water?
You're talking about the ownership of the systems that are owned by companies versus systems that are managed by governmental entities.
Correct.
Okay, I'm going to let Joel answer that. Just for the room, in water, 80% of systems are public and 20% are owned by companies. The opposite, it's exactly the opposite of electric utilities, where there are actually cities that own their own electric utilities, but only about 20% and 80% are private. And the fact that one is one way and one is the other way is just happenstance. We feel like water should be public, and we feel like you should pay your electric bill to a corporation, but that's just the way it ended up. Go ahead. What's
well, I'd be interested, actually. I was going to ask you a question back and try to understand a little bit what's behind that question, and what do you see as the, I think that public and private companies face, somewhat different operating environments, and certainly, do you have bond authority to go out and raise money, or are you doing this in a different way? But in many ways, from a regulatory perspective, they ultimately behave somewhat similarly. So I'd be interested in hearing if there's a...
Yeah, there is. There is a little behind that, and that's that on the public side, there's a lot of bureaucracy around how to get the latest and greatest technologies invested in. We've talked a lot about technology and how that can change the game. On the private side, because it's private and it's shareholder value, the private companies can invest in technologies that are in the next generation of the future of delivering shareholder value back. So as we talk about a public supply, the bureaucracy of the public system typically prevents maybe the next generation investment in technology to have the best systems. Private water has the ability, it seems, to make those investments if they're the right investments for growth.
Yeah, I'm not sure that I know that as an empirical basis that the world is that sort of dichotomous, really. And I guess I would invite us to consider, who are the gazelles among the public water systems who actually are making good long-term, sort of life cycle asset management decisions, because we're going to continue to have a lot of public water utilities around the country, and that's been a good model for us. So what can we learn from the private sector, if you will? But I know this question comes up a lot in the burgeoning conversation around public-private partnerships as well, and do those models offer a better opportunity for thinking about life cycle costs in terms of risk management? And I think we need to kind of continue to drill down on that, and not just sort of accept at face value the arguments, but ask ourselves, what can we learn from that, and how can both public and private benefit from those lessons?
So we don't actually know the answer to the question, do corporate water utilities do better, quote unquote, on public health kinds of things, for instance, than private?
I certainly don't know the answer to that question. Maybe somebody in this room does.
But it's a great question to ask. I mean, I love that phrase, water gazelles, and I think it's a great question to ask. What does it look like to do well, and what does that enable you to do, and what, are there lessons that are transferable? Okay, we're at the end. We got one. Let's take one more question. Tell us who you are, sir.
Sure. My name is Charles Bensinger. I'm with Stonehouse Water Technologies, and perhaps we should be talking more about what we're actually putting into the water. We're hearing a lot now about superbugs, which are antibiotic-resistant bacteria, and we're told that about 80% of our antibiotics go to animals. And also, we're also being told that we're pretty excessive with our use of antibiotics. But the presence of antibiotic resistance bacteria will compromise our entire antibiotic regime. And so the thing about water is it carries everything that's in the environment into our bodies. And people don't give that enough thought, I think. So I guess this is a question. How are we going to prevent the wrong kind of bacteria from getting into our water systems, which are presently unregulated? And also we have fracking, which is also putting a lot of bad stuff in our water systems. So we need to start thinking about different kinds of public policy, better technology, and better public education, I think. So
that's really a big source water. That's a source water protection. I mean, that's the truth. Yes. Is if you wanna tackle emerging contaminants, don't wait till it's in your water plant.
Upstream.
So I'm not sure we're going to solve that in the 60 seconds, but that is a great note to go out on. And I think you're right. We need a different attitude about the source water. One of the things I've seen change in the last 5 years is that people are drawing the circle much more widely. The water that's in the environment in a community is considered part of the water system. The next step is to actually try and figure out how to take care of it. Okay, you guys have been great. Thank you all very much. We're back in here in about 25 minutes for the panel on water and money. And I was going to wait until I introduced the panel to tell you this, but just to make sure everybody comes back, you will leave the room for lunch with money in your pockets from that panel. So come back. Thank you all very much.
So I want to thank Charles, Joel, Roger, Magda. Thank you very much. And before we go out on our break, just a couple points. First, trivia question number 1 for the day under the category of irony. That should give you a clue to the answer under the category of irony. Which U.S. city has the most expensive water when measured as cost per residential family? What U.S. city has the most expensive? The cheapest is either Memphis or San Antonio. They argue all the time. But the most expensive, even before it had its problems, was, the category is irony, you've mentioned it, was what city?
Flint, Michigan.
Flint, Michigan. Even before it had its problems, Flint, Michigan had a water bill per family that was about $900. That's 3 times the average in the U.S. Even before the problems. And it was because the city was using the water revenues to fill potholes and do other things. So I find that kind of an interesting little fact for those of you who like fun facts. Anyway, before you go out on the break, we do have an exhibitor game I want you to be aware of. At registration, you were given a stamp card with participating sponsor names. If you visit all participating sponsor tables and get your card stamped, once your card is completed, you can submit it back to registration and you will be entered to win an Apple Watch. The deadline for submitting is at noon tomorrow, and the winner will be drawn at the close of the summit. Let's have a nice break. We will be back in here at 10:45. Thank you.
Thank you.